start on the outside. We want to find our renal artery and vein. It's our artery.
It's like it's completely missing.
No, it's there. It's just obliterated in blue. But come practical time, I will choose one that is a lot more clear than this one. So you can see the thickness of the vessel right there. So this is the artery there. It's just obliterated in the blue, but you can see the tube in there. So if we position that as the ventral side, then this is going to be a left kidney. Because again, we want our ureter facing downward, and then the renal artery on the ventral side. So once we open it up, again, the hilus is going to be this indentation here where these vessels are entering and exiting. And so the outer region, cortex, inner region, medulla. And this one's nice because it has the yellow representing the urine, so you can really see where those calyces are. So the minor calyces are these small, where it comes up to kind of the horny point, and then the major calyces are these bigger openings here that would fill with urine. Where the calyces all merge together is the renal pelvis, and that's going to form the urinary bladder, the ureter inside of the kidney, and that's then transporting the urine to the urinary bladder. So the renal columns are going to be the white connective tissue between the renal pyramids, which have the collecting ducts and loops of Henle in them. The collecting ducts enter into the calyces. So the tips of the renal pyramids are the renal papilla. So you can kind of see they form that kind of, again, where you've got the yellow coming down in. That's where the urine would actually be passing through the tubes and entering into the calyces. When we follow our blood vessels, the renal artery enters into the kidney and branches off to form the segmental arteries. The segmental arteries branch to form the interlobar. So in each column, there will be an interlobar artery coming up through the column. The arcuate tend to form a line right on top of the renal pyramids. So this one doesn't have any really great arcuates. You can see kind of an arcuate vein here. See how it wraps around and forms like an arch there? So the arcuate vessels arch. Then in the cortex, it's going to be the interlobular arteries and veins. So the one with the U is up in the cortex, the lobar is down in the medulla. The vein side, if we take it back out, our interlobular veins go down to the arcuate to segmental, to interlobar, and then the interlobar go directly into the renal vein. So there's no segmental on the venous side. Cortex, medulla, pyramids, papilla, columns, blood vessels, pelvis, hilus, calyces, and capsule. So I think we're there.